Hi, I'm Patrick Geraghty. I'm a vascular surgeon. I'm a professor of surgery and radiology at Washington University in St. Louis. I'm the co-director of the limb salvage program at Barnes-Jewish Hospital, and I'm speaking here at the VEITHsymposium. So we added a couple new data points. The previous data points included the improvement in primary efficacy, particularly when looked at by Kaplan-Meier, and the excellent safety data through 6 months. What we added today, we looked at gender differences. There were no differences in safety and efficacy outcomes between male and female genders, which was good to see. We also added some additional data regarding combined patency endpoint of clinically driven TLR and occlusion, which was statistically significant by Kaplan-Meier analysis at 6 months. Then we broke that apart into clinically driven TLR and overall occlusions gleaned both by duplex ultrasound and angio at TLR, and found significance in both of those at 6 months. You know, I think as the first positive IDE trial is the real standout there. So the previous IDE trial was the Impact Deep, which did not show the appropriate safety signal. And so that was a concern. So we're very pleased not to see any differences in amputations through 6 months and overall excellent safety. And in Impact Deep, they could not see a biologic effect in terms of an efficacy signal either, and we're seeing that. So in both of those two main modalities, we're seeing the appropriate signals. I think each one obviously is going to have to independently prove safety and efficacy. Given the disparate results between these trials thus far, I think it's clear that we're learning about how inhibition of restenosis, and particularly the use of paclitaxel, how those outcomes occur both with dosage and excipients and all the different variables. So I think it's important that each balloon gets independently examined, that we learn those independent data and not simply assume that a field effect exists across the entire assortment. It's exciting just getting to the end. You know, we have been 5 years thus far getting this data set enrolled and following up to this point. It's a tremendous amount of work, and I'm very pleased to see that our hopes for the ability to biologically modify outcomes below the knee appear to be proving out as a positive. That's extremely exciting. I think there's still a ton of work to do to understand this and see the longer term outcomes for it, but our first 6 month glimpse is positive. We're seeing, compared to standard balloon angioplasty, we're seeing a better signal. So maybe we can keep these patients out of the lab a little bit longer before reintervention. I'm hopeful that in a broader patient experience that area under the curve in terms of better patency at 6 months might translate into better outcomes in a broader population for amputations and wound healing. Hopefully we can find a way to look at that subsequently in registry data. There's a lot of what ifs there, but in general it gives me one step forward, I think, in management of challenging patients. If I can extend patency a little more without a negative safety outcome, then I'm one step further down the road.